Everyone. Hello. Thank you so much for joining us on a Friday afternoon. So my name is Charlotte. I'm from the Center for Health Activation, whom you receive all these emails from. Yeah. So today's talk, it's on how to preserve a severed finger. Before I pass the time on to our staff nurses who's seated out here, I'll just go through a few of our admin information. Okay, so at the end of the talk today, we will actually have a special Q&A session. So if you have any questions in the course of this talk, do use the Q&A function because it's a webinar and you will not be able to unmute yourself. So do use the Q&A function. You can find it at the bottom of your screens. Type in your questions, and after that, our speakers will take a look at them and answer you either by typing as well, or they will actually unmute and then respond to your questions at the very end. Okay, and then before we leave from today's talk, there is, as usual, our online survey form for you to fill in. One last thing, today's talk will actually be recorded, and then subsequently we will upload it to our TTSH YouTube channel. Don't worry, we won't see anybody's faces except ours. Okay, so do stay around, and then I will just very quickly pass on the time to our two speakers to do their self-introduction before we continue to talk proper.
Okay, thank you. Hello, everyone. I'm Nora Shkin. This is Shamil Leong. We are both from Level 12 Santosi Hospital, Ward 12C. We are both an orthopedic specialist, trained specialist. Okay, so let's start on today's objective, if I can. Hang on. Hold on for a while. Okay. Okay, let's start on today's objective. So we will introduce what is digital amputation, types of hand injury and common cause, treatment and plan for hand injuries, and education, and demonstrate on how to preserve an amputated fingers. Okay, so what is digital amputation? When we mention digital, is often associated with our fingers. Digital amputation is quite common in our ward. Therefore, learning how to ensure a finger are kept in a good condition would be a great help. So one of the common causes for a finger to be amputated would be traumatic injuries. Traumatic injuries such as accident from a power saw, knife, or as simple as a door. We do have instances when amputation is needed for a patient who has medical condition, such as Dupuytren's disease, where thickening of the tissue surrounding the palm can have one or more fingers to curl up towards the palm. So this might affect the hand function. Therefore, an amputation is needed to regain the functions. Patient who has peripheral vascular disease, such as diabetes, that sustain a non-healing wound due to poor blood circulation associated with the disease may eventually get amputation due to the tissue being infected and becoming black, or as we call, what we call as gangrene. So amputation may occur to severe infection, such as necrotizing fasciitis, where it's known as flesh-eating bacteria. So at the late stage of necrotizing fasciitis, where the patient does not respond to antibiotics, tissue will turn black and an amputation is necessary. So next, let us look at some statistic we have from digital amputation. So traumatic digit amputation accounts for 1% of all trauma admissions. The most common amputation would be finger and thumb. Fingertip and partial single-digit amputation are the most frequent presentation in A&E. Most injuries occurs at home from saw related to vegetable knife, but in some recent years, we mainly receive a lot of industrial accidents cases from construction workers to meat grinders. Since the adult are handling most of the hazardous equipment, incidence is higher in adult, and men are 4 times likely to sustain the injury than women. Okay, so in a traumatic situation, the goal is to salvage the finger to restore function, especially when the patient's affected hand is the dominant hand. We will take into consideration from the time of the injury, how did the injury happen, and what type of substance mixed with the tissue. And when it comes to treatment, the end goal is to ensure good functioning length of the finger, enough coverage of the wound, ensure patient can feel things with their finger, prevent joint contracture where the fingers can curl in affecting the hand functions, and promote early return to work. Okay, so next I will talk about the types of injury and common causes. The next few slides contain images that you may find disturbing, so please look away if you feel uneasy. Okay, so here we have an abrasion injury where layer of skin was stabbed, forcefully causing the muscle, tendon, tissue to be exposed. This can be affected from high-intensity sports or a bad fall from height. Next, we have laceration, when there's an open wound caused by a cut from a broken glass or a blunt force trauma, such as physical attack from a dull objects. Next, we have a crush injury, where force or pressure is put on a body part. It can happen when the hand is squeezed in between two heavy objects. This could be caused by a construction worker's hand pinned down by a heavy concrete wall. Or for example, I have an injury case in my ward not long ago, where the patient's hand went into a sugarcane presser, or he or she sustained a hand crush injury. Okay, so as I mentioned before, the cause of the hand injury could be doors, power tool, or when we are doing a simple task such as chopping vegetable meat. Okay, so let's talk about treatment and plan for hand injuries. At the initial stage, we preserve the amputated part. This will be covered by Charmaine later. Tetanus shot will be given as a precaution, as we would not want tetanus infecting the wound. Tetanus is deadly disease that can cause trouble breathing, locked jaw, or muscle spasm. Okay, so next, doctor will start on antibiotic treatment as a prevention for any sort of bacteria that can cause infection and affecting the wound healing. Okay, so normally directly from A&E, patient will be transported to operating theatre, where a group of medical team will assess the wound and the amputated fingers for any tissue viability. It will take about 2 to 10 hours depending on the complexity of the wound injury. Okay, so these are the orders of which they will repair the wound. After they wash out the wound of the debris and any contaminant, they will fix the bone, as you can see from the picture. Okay, so not only that, the bone also can be shortened to allow repair of soft tissue, as tissue loss can occur during incident. After that, they will fix the tendon, where the patient can have back their normal motor function. Next, they will do a nerve repair to regain sensory surrounding the tissue so that patient can feel again. Next, they will do an arterial anastomosis, where the doctor will reattach the artery to have an oxygenated blood circulated into the wound for good wound healing. And lastly, venous anastomosis, where veins will be reattached to have blood circulation surrounding the wound for wound healing as well. Okay, so when all is done, everything will be covered with skin and stitch closed. And healing can take up to 6 weeks. For the first 2 to 3 days, patient will be closely monitored to ensure tissue is healthy, pink, with good backflow and turgor. Hospitalization period can be in between 5 to 10 days or longer, depending on the severity. Okay, so next I will pass to Charmaine now to explain further on preserving and amputated fingers.
Thank you. Okay, so I'll be touching on the education and giving some screen demonstrations on how we can deal with the amputated parts. So firstly, prevention helps to reduce the incident from happening. So I mentioned earlier on, most injury happens while at home. So here are some of our advices on how we can prevent it from happening. Firstly, if you are dealing with any electrical appliances, to read the instruction manual before using them, because most of the manual will actually highlight what are the precautions that is required to take. Secondly, when we are dealing with cooking and stuff, we can actually also don on protective gear, such as our gloves when we are preparing to cook. This could also serve as a layer of the barrier when you are performing cutting or even when you are doing grinding. So for our hard labors workers, WHS actually implements some regulations to have some safety protective gears while they are on site. This is to ensure a safe working environment is created so that they can reduce occupational hazard related injuries. So next, when a machine is malfunctioned, to kindly unplug the equipment before we troubleshoot why it is faulty. So we don't want the equipment to start working when investigation is ongoing. Lastly, also to avoid handling equipment after alcohol is being consumed, or if you have taken any medication that has a side effect of drowsiness. This could help to reduce the reaction time when there's a sudden encounters. Yeah, so from the next slides, this will be the steps that we will be sharing how you can assist our surgeons and patients when an incident happens. So our first step, you can see that to prevent and preserve amputated part, we will first need to wash the amputated part for all the debris and the dirt. This could help to prevent the amputated part from further contamination. But also apart from that, there is also the bleeding source, to also do stop the bleeding source with some pressure. So yeah, to press on it to stop the bleeding while we are preserving the amputated part. So the best cleaning solution is always normal saline. However, we don't carry normal saline everywhere. So plain water, clear plain water to rinse off is fine enough. But in the situation where you are too scared to actually wash off the debris and everything, it's okay. You can skip this part and move on to the next. So second step, you can wrap the amputated part with a wet gauze or a clean wet cloth before we put into a dry bag. So this can actually prevent the digit parts from drying up, and also to avoid any direct contact of water to the amputated part. So soaked digit will actually cause the wrinkling of the skin. Then this could cause shrinking and expanding of the skin cells. Then that might not be able to save the part when we actually receive from our end. So the third step is to put the well-wrapped digit into a dry bag. Then we will prepare another bag filled with ice cube of cold water. Then this to actually avoid any direct contact of water or ice to cause any maceration or frostbite to the skin cell. So it will be a bag inside another bag of water and ice. So lastly, if you have actually a cooler bag, So if let's say you have a digit, you need to make sure that it is passed to the SCDF staff, the right patient with the right digit, especially when there's an event that involved with more than one casualty. So just need to make sure that it's the right patient and right digit. So lastly, if let's say you have a cooler bag, you can store the cooler items into the cooler bag then, so that the colder temperature we can actually preserve higher, and it can reduce the risk of the tissue from dying earlier. So the important takeaway from this whole presentation is that an amputated part can be used as a skin, bone, or nerve graft. That will depend on the level of injury sustained by the patient. Because of Singapore hot weather, we have to be very tactful of the temperature of the water that used or how we store the amputated digit. So if temperature of the preserved bag is very high, and irreversible muscle damage will occur, and we might not be able to use the affected parts that's being saved by you. So our digit can actually preserve up to 24 hours during the colder conditions. So this is the end of our presentation. Thank you for your time. We will proceed with our Q&A session.
Okay, so that was very, very practical skills that our staff nurse went through. So if you do have any questions, do use the Q&A function at the bottom of your screens to type in your questions. So I know most of you might be on your phones and it may take you a while to actually type them out. So we're just going to wait quietly for a few minutes, okay, before the questions comes in. Okay, we do have a request to show for the slide for step 2 and step 4. I believe it's the ones that shows you how to preserve. Yeah, maybe we'll just take some time to go back to those 2 slides. For the rest of us, if you have any questions, just feel free to type as we are going to show the slides beforehand. Yeah.
Probably I can go through the slides, the steps 2 and step 4 part. Yeah. So basically there's a cloth, wet cloth or wet towel. So you can wet with the saline if you have, but if you don't have, it can be a clean plain water. Then after that, the digit will be here. Can see? Sorry, I didn't see my screen. I'm sorry, you can see. Then it will be like this. So this hand will be the cloth itself. So the digit will, if you found, it will be here. Then after you wrap, then after that you put into a dry bag, the plastic. Then after that we'll get a separate bag itself again, with another cooling water or ice cube. Then we'll put that bag of digit into the bag. And then after that, it will be soaked inside the bag. So it will be, there's a barrier from the original digit with the cloth and the dry bag.
Okay, so basically step 4, the reason why we say you need to identify is because if let's say, for example, there's more than one patient, so you have multiple fingers. So we really need to make sure that finger belongs to the patient when we go to hospital.
Saline usually in hospital is actually a salt and water solution that we use to clean because it's more neutral and more gentle to skin when we need to do the cleaning. So we usually in hospital, we don't use tap water, we use saline. But of course, if you are around, then at home, if you don't have saline, clean water is also can. Can we use tissue to wet?
You cannot use tissue. Because tissue can stuck into the thing and the amputated finger itself. Then it'll be harder for us to clean. We don't recommend you putting your own salt into the water. So at the end of the day, if let's say you're interested to buy saline, you can always go down Guardian or Watson. You can buy a sodium 0.9%. That should be enough. Just a bottle will be good, just to keep at the side. But of course, you also need to make sure that the expiry date, you won't go over the expiry date. Yeah.
Can you?
Yeah,
Can. We can use cold water from the fridge.
But it would be better if you have ice.
Because the temperature, the colder it is, it actually can help to preserve the digit before it arrives to the hospital.
So normal temperature water in Singapore, I don't think is enough. At the end of the day, we still recommend ice.
Wrap the yes, you for the wrapping of finger with moist gauze, you can actually use with salt water or you can use clean water also can. This is just to keep the temperature. Cold water from fridge to
No. Just normal water. Normal water, but make sure when you put into another plastic bag, there will be an ice there. A lot of ice. Yeah.
Yes. That water. Can because if a certain situation we cannot be bringing a lot of items, so we just try to optimize the best situation that we can. If there's no plain water available, tap water also
Okay,
plain
so
water are not no drinking water lah. The normal tap water also can be.
okay, get
Yeah.
that water. Yeah. Can
What can be?
if cannot find goes or clean cup. Okay. So in this situation where you cannot find anything, it's okay. Take the thing, put in a plastic bag, that's it. The paramedic will be the one dealing with the amputated finger.
Mm.
Okay, so we had a few questions that our speakers actually answered. So I guess since we have time, let's us move on to the back of our slides first. I can show everyone the feedback QR code. So while the rest of us are thinking up questions, those of us without questions, you can go ahead to scan the QR code first and then fill up the feedback form. So today's copy of slides, if let's say you feel that it's a bit hard to read the slides from your phone, you can actually put in your email into the feedback form, and then we will send the slides over to you for reading or for reference purposes. Okay, so no hurry. If you still have questions, you can type them. If not, for the rest of us, you can go ahead to do the feedback form first. Okay, just give us a while. My colleague will also put the link to the feedback form into the chat so that you don't have to scan with your phone. Okay, and then for those of you who have been coming for a few of our previous health talks, you can always revisit those that you have already done before. Okay, by scanning the QR code as well. So TTSH Health Library, everything is up there. Whatever other conditions that you might have, you can also refer. And of course, because now it's the year end, we do have an upcoming health talk all the way in February next year if you're interested in diabetic foot care or if you know anyone who might need the topic. Okay, perhaps today's topic may not be very applicable to everybody. So I do hope that, if you're ever in need of this kind of skills and knowledge, you will find it handy. But otherwise, if you don't have any questions, we will leave this room open, okay, until at least 2:30 for you to scan the QR code, for you to type any questions if you have. And then otherwise, if we don't have any questions, we will close it at about 3:30, not 2:30, sorry. Okay, so we will leave it for now. So don't worry, our speakers will still be around for your any questions.
Okay. So maybe I should tell you why we decided to make this topic for today. Mainly because firstly, we have a lot of domestic workers. We have a lot of friends who are working in constructions. So many times we cannot, no, not many, but sometimes we cannot salvage the finger. Mainly because maybe it took some time for them to reach to the hospital, or maybe it's not in a good condition. Yeah, so we always talk to the doctors, and doctors always said to us that, when it comes to preserving that part before they reach the hospital is the most important part. Yeah, so they can, with that information, with that knowledge, you actually really can help someone. Not your friends, but it's just a random passerby who you saw. Also, you can help. At least you know what to do. At least you can help them in future. Yeah. So got one question here. Hey,
Oh,
thanks.
thank you.
Okay, hi. I believe there's someone in the audience that asked how to register for the food care, right? Because the form is not available. No worries. I've got your name. I will back end. We will send you the email to register again when the form is open. Okay, so sorry for the technical error. But yeah, thanks for highlighting. Now we know. Okay, we'll contact you via email after this to help you register online. Yeah. Okay, and for the rest of us, another 2 more minutes till we close this chat. Okay. One more minute till we close the room. So thank you everyone for staying with us. It's 18th of December. I don't think I will see you guys before the end of the year or before Christmas. So here's a merry early Christmas from all of us to you. Okay, and I hope you have a good weekend ahead. Yeah, even though it's just Monday. Okay, and we do hope to see you again in our next year's health talk. Okay, thank you so much. We will close the room in about a minute's time. Thank you. Okay, thank you everyone. We are going to close the room. Yeah. Bye.
Happy New Year.